The pelvic girdle is formed by the hip bones, sacrum, and coccyx. These three bones are also known as the innominate bones, pelvic bones, or coxal bones. The articulations within the pelvis are pubic symphysis at the front side and sacroiliac joint at the back side. The pelvic bone consists of three bones, which are ilium, pubis, and ischium. It is separated by triradiate cartilage, that Y-shaped epiphyseal plate, which occurs at the junction. The ilium extends superiorly to the hip joint. Therefore, it comprises the superior portion of the acetabulum. The ischium, it is the massive posterior inferior part of the hip bone. It fits into the posterior inferior third of the acetabulum. The pubic bone, it builds the anterior inferior third of the acetabulum and is the anterior inferior part of the bone that articulates with the contralateral hip bone. The acetabulum has a C-shaped acetabular margin that is accentuated by cartilaginous acetabular labrum and completed inferiorly by the transverse acetabular ligament. It is the lateral surface houses the most prominent landmark of the bone. It is a socket-shaped articular surface which the hip bone articulates with the femur and makes the hip joint. Sacrum is a triangular bone that consists of 5 fused sacral vertebrae. It has anterior and posterior surfaces. The anterior surface is smooth and concave, while the posterior surface is rough, irregular, and convex. Coccyx, otherwise known as the tailbone. It is a small triangular-shaped bone comprised of 4 fused coccygeal vertebrae. It marks the terminal point of the vertebral column and contributes to the formation of the wall of the true pelvis. What about the function of the pelvic bones? It supports and protects the pelvis, support body weight, enables to walk reasonably, provide muscle attachments, and also provide bony support for the birth canal. Lastly, it allows the bones of the lower limbs connecting them to axial skeleton.